A living will is a document that says if I have a terminal or irreversible condition, and it gives you two choices. I want all life-sustaining measures or I want comfort care. We're talking about end of life. Well, in the medical field, we don't find that form extremely helpful because it's very vague and very general. There are a lot of situations in which that aren't necessarily terminal or irreversible, but could still leave you in a condition that's unacceptable to you. We have found through our years of doing advanced care planning that many people who have a living will and have chosen the comfort care only choice at the end of their life, they think this automatically makes them a do not resuscitate or a DNR. And that is absolutely 100% not true. A DNR is always a physician's order. You have to, if you have a living will, you have to enact your living will every time you come into the hospital. We don't ever want to assume that every time you come in the hospital, your wishes are the same. We also developed a form here at the hospital in which we talk about things that you're going to see or that might be done to you or offered to you at the end of life. And it's just, it's an addition to the living will, if you've already done a living will, and it goes into more specifics. We talk about things like CPR, breathing assistance, which could mean something we call BiPAP or CPAP, which is breathing assistance, but it's just using a mask that you have to wear 24/7. It molds around your face. Or we talk about being on a ventilator. We also talk about a feeding tube. We talk about the risks and the benefits of all of these things and situations where they might be acceptable to you and situations they might not be acceptable to you. We go into a little bit more detail that if you want these life-sustaining measures, would you want them forever if you're not getting better, or would you want a time-limited trial? And if we haven't been able to, if your situation hasn't improved and all the treatments that we're doing aren't working and you're not getting better, would you want to be kept alive on these machines indefinitely? So those are the kind of things that we talk about. I always say that advanced care planning is a gift that you give to your family because it removes the burden of decision making from them and it helps to ensure that your wishes will be honored.